Good evening, everyone, and thank you for joining us. My name is Mary Alice Cohen, and I am the Division Director for Community and Family Support. We are excited to share the recently released statewide needs assessment and strategic plan, which supports children ages 0 to 5, their families, their caregivers, and other early childhood professionals across the state. Our teams visited communities around the state, and local advocates supported additional stakeholder events, which provided us with the opportunity to hear your concerns, better understand your needs, and elevate your solutions to the state's most pressing challenges. The information our team is sharing tonight is a reflection of that effort. I will now turn it over to Lindsay Dorneman, who is leading our Colorado's Preschool Development Grant work, to share this exciting work.
Thanks. Thank you, Mary Alice. And before we dive in, attendees or participants, you're currently muted. So unfortunately, you won't be able to speak, but or if you do, we won't hear you. But if you have questions while we're presenting, please fill out those questions or submit those using either the chat or the question box provided through the webinar. It looks like we may have a sound issue. Yeah, can someone else let us know if they're having issues hearing us? Great. So if we do cut out or if there's issues, please let us know, again, using chat or questions. This webinar will be recorded and shared on our website. We'll also send it out to folks via email by early next week. All right, so I think we can jump in. Okay.
A little quiet.
Oh, maybe if I don't speak at my computer screen and talk towards the speaker, hopefully that's better for folks. Again, just let us know if you're not hearing us very well. All right, so in 2019, Colorado was awarded $5.8 million to launch a preschool development grant. This funding was designed to help states implement changes to their early childhood care and education systems, maximizing the availability of high-quality options for low-income and disadvantaged families across providers and partners, improve the quality of care, streamline administrative infrastructure, and improve state-level funding efficiencies. While the focus of PDG is really on early education programs, the federal government and our office recognize that there's a broad system of programs in Colorado, in addition to early care and education, that support children and their families and are necessary to ensure that there are high-quality support for vulnerable and underserved families. In 2020, or late last year, Colorado was one of 20 states to receive a renewal grant valued at $11.1 million per year. This is a 3-year grant that will annualize at $33.5 million. The purpose of this renewal funding is to take what we've learned over the past year and implement that as part of our statewide strategic plan. On your screen, there is a link that will allow you to access the 2 documents we'll refer to this evening. The first is the statewide birth through 5 needs assessment. This is the first statewide needs assessment completed by Colorado since 2011. The second document we encourage you to access is the statewide birth through 5 strategic plan that launches in 2020 and will conclude in 2025. This is the first statewide birth through 5 strategic plan and has recently been endorsed by the state's Early Childhood Leadership Commission, who will be helping us champion and ensuring this work captured in this plan is completed over the next several years. So before we get started, for those that have access to the strategic plan, there's a little bit of an orientation. So when you look at the strategic plan, strategies are marked by two icons. It's important to note that those that are marked by a state flag are the strategies that are funded through the Preschool Development Grant. What that means is that these strategies are resourced, we have funding, we have staff, we have a commitment to ensure those strategies will be completed over the next 3 years. The second set of icons, or the second icon, are the shaking hands. And strategies marked by this icon are strategies that we will be looking for local or state partners to take on and champion to ensure those strategies are also adopted and acted upon over the next 5 years. Again, the Office of Early Childhood will be working with the Early Childhood Leadership Commission to ensure that we identify champions and successfully accomplish those strategies. The statewide strategic plan is a living document. So what you see in this plan currently is not what we expect to see over the next 3 to 5 years. We do have plans to work with the ECLC to continuously refresh this plan to reflect changes to Colorado's landscape as a result of legislation or other initiatives or opportunities that come into the state. And so we really do want to encourage partners to continue to stay engaged and be a part of that updating process. So how did we get here? So in 2019, as Mary Alice noted, the Office of Early Childhood and our partners, whether they were local agencies or vendors, engaged a large number of stakeholders across the state. In fact, we were able to engage more than 10,000 individuals or receive 10,000 inputs over the course of the year for all of our PDG birth through 5 activities. Of those, 6,000 were used to inform the statewide needs assessment and the strategic plan. Of those, about 5,200 came directly from families of children 0 through 5. One of the tools that we used for the needs assessment was a family survey that went to parents, guardians, and caregivers of children 0 through 5. We received a total of 3,400 responses. And if you look at your screen, you'll see the map of where those responses came from. We're really fortunate to have that many responses as it allowed us to break apart the state in 6 regions and be able to do a deeper dive into the needs of each individual region. The parent survey was not the only tool we used. While it did allow for geographically representative samples, we also had to do some additional work to make sure that we had greater reach into underrepresented families. Families whose primary language is not English, members of refugee and immigrant communities, members of the Ute and Southern Ute tribes, families experiencing homelessness, fathers, and others. So to accomplish that, our needs assessment vendors completed I will slow down. I feel like I'm a pro at this point, so I apologize. So our needs assessment vendor completed 9 focus groups with families during the course of the project across the state. They were able to engage 102 family members and guardians, of which 36% came from rural counties in Colorado, and collectively, this group represented 29 counties. Additionally, we partnered with our strategic planning partner, CalTrends, who also worked with Early Milestones Colorado and the Marzano Research Group to do additional surveys and focus groups. They, through their efforts, spoke to an additional 1,400 parents and caregivers. If you look at the screen, you'll see some of the demographics and characteristics that we targeted throughout this process. Again, ensuring that families who may not always be represented in our work were definitely represented through this project. The documents we're sharing today also represent outreach and engagement of partners. So we completed extensive outreach to child care providers, early childhood professionals such as home visitors and mental health specialists, representatives from early childhood councils and family resource centers, policymakers, and other advocates or individuals working with children and families. These partners use surveys, focus groups, and key stakeholder interviews, as well as a series of community conversations to provide feedback to both the state and their partners. One example is shown on your screen. We were fortunate to have Senate Bill 63, the Family Child Care Home and Infant Toddler Decline Act, passed during this year, which allowed us to engage additional partners to have these conversations. Through that particular effort, we were able to engage about 1,000 child care providers throughout the year. So through all of this outreach, we were able to identify 12 opportunities to better support children and families across Colorado. The opportunities that we're sharing this evening are not listed in any specific order or priority, and we were able to address each of these opportunities through the strategic plan. The first 16, which are currently displayed on your screen, focus more on early care and education programs like child care and preschool. The second set of needs that are appearing on your screen speak more broadly to concrete supports and other programs that support young children and their families. These needs also focus on system-wide issues such as rural outreach and the availability of data. So let's dive in. So the first need is unlikely to surprise anyone, speaking to the availability and access of childcare, especially for infants and toddlers. When we surveyed parents, they universally cited a childcare setting's ability to provide a safe and supported environment and positive childcare and caregiver interactions as major reasons in choosing childcare. The next set of highly rated attributes included the learning environment, socialization opportunities, and flexible scheduling. What this tells us is families are seeking safe and quality care for their children. However, it's not necessarily accessible, and the reasons parents cited for barriers to choosing the care setting of their choice include the cost of care, the space or availability of child care, location, and the ability to accept child care subsidy or assistance. Interestingly enough, over half of parents surveyed, about 53%, stated that they had to turn down a work opportunity in the past year because they could not find or afford care. So this need that we're identifying has a pretty deep reach and an economic impact not only for families but their communities. So we know that parents are having difficulty accessing the type of care of their choosing. However, we have not previously had a way to quantify that need. When we worked with our needs assessment vendor, the Colorado Health Institute, we were able to develop a child care model that allowed us to estimate the number of children in licensed, informal, and parental care today, otherwise known as current state, and the number of children who would be cared for in each of these settings based on parental preference in the absence of any barriers. So again, if you did not have to worry about cost or location, what choices would you make for child care? So on your screen, you're seeing one output from that model that focuses on licensed child care. This model estimates that in the desired state, so again, absent any barriers, parents would choose licensed care, resulting in an increased need of 3,900 or 39,000 slots. So that means that we're really looking at how we can increase the availability of licensed care to meet that parental need. When you look at your screen, there are age breakouts that allow us to dig a little bit deeper into this model. So as you can see, we're currently at 89% of the desired need for children ages 3 to 4. So thinking about preschool. However, the disparity between what's available and the parental needs grows as children decrease in age. So when we look at children ages 12 months and under, that need increases to 56%. So how do we plan to address this? Again, the state engaged in stakeholder engagement around Senate Bill 63 that allows both providers and families to speak to solutions to the decline in availability of care, specifically family child care homes. The recommendations that came out of that work were presented in a report to the state legislature and available to the public. This action plan can be accessed online at both the Colorado Office of Early Childhood website as well as the Early Childhood Leadership Commission's website. Recommendations looked at infrastructure, it looked at rule and regulation, and really tried to dig into some meaningful support that the state could provide to licensed child care providers. Findings from this report were also incorporated into the statewide strategic plan for the preschool development grant. Some additional activities contained within the statewide strategic plan that will be addressed through the preschool development grant include supporting ongoing work around the Colorado Child Care Assistance Program contract for SWAT implementation. So in 2019, the state worked in partnership with Early Milestones Colorado and a number of counties to pilot contract for SWAT to determine the policies, processes, and supports necessary for expansion of this program. And we hope to start rolling that work out over the next year. Additionally, through the preschool development grant, the Office of Early Childhood will be offering a micro-grant program for formal early childhood education home and center-based providers to support startup costs, targeting providers in deserts and providers serving infants and toddlers or children with special health or developmental needs. These microgrants are really designed to reduce barriers for providers who intend to become licensed but have a challenge that could be addressed by funding. So we are really excited about the opportunity to support providers in this way. Additionally, through the preschool development grant, we have a continuous lens on supporting a mixed delivery system. So as the landscape continues to change in Colorado, we want to ensure that we're supporting home, community-based providers, as well as school-based providers. So the second means that we'll address tonight is providing more equitable and culturally relevant care. So as families are having difficulty accessing care, we're finding that this need is more acute for families that have concerns about the ability of a program to offer culturally relevant education or settings. In fact, 23% of parents know that the inability to accommodate a child's language as a barrier to accessing the care setting of their choice. It's important to note that our outreach was conducted largely in English and Spanish, so we imagine that this need may be larger for additional communities in Colorado. On average, 46% of parents reported culturally relevant information and programs as a major driver when choosing care, therefore making cultural relevance very appealing to families and engaging them in care settings when that's offered. So to address this need, the Office of Early Childhood is looking at reworking the Colorado Science Quality Rating and Improvement System framework to ensure not only alignment with best practices, but an increased emphasis on cultural and linguistic responsiveness and inclusivity. So some of that work was completed in 2019 and we'll be implementing recommendations over the course of the next year to ensure that cultural responsiveness is part of our new framework. Again, we're looking at additional populations that may feel the need to access care more acutely. This time focusing on families of children with special needs. So as a result of the parent survey, we learned that 34% of parents cited inability to meet the needs of their children was a barrier to access when their child had a special need. To address this, we want to make sure that our early childhood education providers have the tools, resources, and training necessary to be able to care for children who may have a special need by supporting not only training opportunities that would connect providers to information about Early Intervention Colorado, which is the state's Part C program, but also preschool special education. In addition to that, we will be working with individuals in consultative roles who support child care providers. So thinking about our child care health consultants, even early childhood mental health specialists and QRIS coaches, and training them on ways that they can support providers in making appropriate referrals, and again, enhancing their knowledge about the resources that exist to serve children and families, especially children with special needs. And finally, we're resourcing this work. So the state is offering microgrants that will allow providers who are serving children with special needs or who are interested in supporting universal design to access consultation, materials, and instruction that would support them to be able to create those environments. All right, so now we'll shift gears to focus on the workforce. So we know that Colorado is experiencing an early care and education workforce shortage, and that became very well known to us in 2017 following a workforce study. So from that study, we were able to learn the level of turnover experienced in leadership positions as well as by lead teachers in early childhood programs. Community-based programs and Head Start centers tended to experience higher rates of turnover across job roles in comparison to public school-based early care and education programs. So it's really important for us to understand that so we can target efforts not only to specific settings, but programs as well. So to address this need, Colorado is thinking about how we better recruit, retain, and support the professional development of our workforce. One of the strategies that will be resourced under the Preschool Development Grant is the provision of the Child Development Associate Credential through scholarships that are targeting under-resourced individuals, ensuring more equitable access to this tool. The scholarships will be accompanied by resources that will support review so that we can ensure not only review is timely, but is able to be completed in multiple languages. Additionally, the state will be expanding course offerings on the Colorado Shines Professional Development Information System, which is the free, on-demand, online training system for early care and education professionals and those that support them. In addition to the need to recruit and retain a workforce, we also heard from families about the need to ensure our workforce is diverse. Colorado's under-5 population is 31% Latino-Latina, 7% African-American or Black, and 3% American Indian. While that's aggregate data, if you look at your screen, you'll note that geographic variation across the state is significant in terms of the populations that exist in Colorado. Additionally, in focus groups, we learned that participants, especially families, noted that professionals do not always represent the diverse children they serve. And so to support families, especially as they make choices for the care that they provide their child, and as we support those environments, we want to make sure that we are providing e-learning courses and other training offerings, especially those, again, on the Colorado Shines Professional Development Information System in multiple languages. So through the Preschool Development Grant, we will be building the PDIS system on a new platform that allows us to translate that system into Spanish and offer more courses in Spanish as well. So this next need is really about ensuring that child care providers have the ability to become licensed as well as sustain a viable business model. This opportunity really surfaced in our focus groups with child care providers, as well as through the work completed under Senate Bill 63, as well as a survey of licensed child care providers. So again, we know that child care providers in all settings wear a number of hats. We also know that there are a lot of challenges that come with becoming licensed and maintaining that license, as well as operating a business. So to help our providers who are either choosing to enter this field and become licensed, or who are currently licensed but may need some additional support, we are planning to partner with a national center that offers business training, catering specifically to child care providers, including both homes and centers. And so this training allows us to support a stronger business acumen for those individuals who are operating those facilities. We also know that providers often need a higher touch. Our consultative partners and our coaches provide a lot of necessary support to our providers, however, may not be as accessible as many providers would like. Therefore, we're offering a coaching pilot that will allow us to place 4 to 6 additional coaches in the field, targeting areas that are noted as coaching deserts, but also creating the opportunity for these coaches to travel and serve more providers. Along with that, we'll be looking at a telecoaching model that will again increase the capacity of our coaches to be able to consult with and work with our providers. Finally, we're looking at opportunities to align consultative roles. So looking at early childhood mental health consultants, food program sponsors, curious coaches, EQIT coaches, and healthcare consultants. How can we support these consultants in understanding the roles of each of them? So what do each do? How do those roles differ? How do they align? And equipping these individuals with resources that allow them to better support providers. So your food sponsor may be receiving questions about quality improvement. We want them to be able to either address those questions or direct a provider to the appropriate resource to get the support they need. All right, so next we are shifting into the second set of opportunities that focus on broader needs for families of young children. So the first need really speaks to families' ability to access information and resources that not only support their child, but the whole family. It was surprising when we asked what services are locally available when needed. Families responded, of course, medical and dental care. However, up to 19% said they were not sure of what services were available locally that were able to support their child. Additionally, up to 65% of families had no knowledge of any supports at all that were available to their child. So thinking about what may support child development or learning, or social emotional development, parents just really didn't have an understanding or awareness that those things existed, not only in their community, but at all. So we know we have our work cut out for us on this need. After working with both professionals working with families as well as surveying families themselves, we were directed into the need to develop an information resource hub that would allow families not only to search for, but to connect to needed services. So what this will look like is essentially a website that will have the functionality of connecting families not only to child-focused resources, but resources that serve the whole family, such as transportation, housing, even feeding assistance. The office continues to invest in supporting parental choice, and so really understanding what parents need and what their preferences are and how we can help them meet both their needs and their choice. And so that work will help inform ongoing efforts around parental awareness and engagement. Finally, the office will be working on research around best practices for local models of coordinated application and service navigation. We know that several communities in Colorado are doing really great work around this, and so we want to do some learning about how they're making it work, how they're engaging families in this, so that we can develop a resource that can be shared with other communities, identifying best practices for coordinated applications and local navigation. Next, we will talk about transition supports and knowledge. The parents that we work with shared that children transition best when they have a nurturing environment and when their teachers and child care providers or other service providers understand the child's previous care and education environment. This is a repeating theme for parents, child care providers, and other early childhood professionals. However, each noticed that systems to support this work are currently absent. As a state, we recognize that children transition often or frequently as they age from birth through 5. And so the transitions that we plan to focus on through the Preschool Development Grant are not limited to that major milestone, which is kindergarten entry, but really looking at what does that transition look like when a child leaves the hospital with their family, perhaps when they enter or leave Early Intervention Colorado, enter or leave preschool special education, among other programs. And to address this, the Office of Early Childhood is looking at the development of a statewide birth through 5 transitions roadmap. That's a really big statement that doesn't have a lot of detail. And so what that means is that we will be working with the Colorado Department of Education Preschool through 3rd grade office, as well as the National P3 Center, to survey across environments, across local community partners, across providers to understand what is working well to support transitions, what's available, and what's needed, and then to build tools and resources that are responsive to the needs identified through that work. Next is the expansion of early childhood mental health consultation. So we're excited to learn that 52% of parents rated early childhood mental health services that address challenging behaviors or social emotional development as extremely or very important to the care of their child. This flags for us that families are aware of this service and do find value in the ability to access it. However, that same percentage, again, 52% of parents, were not aware of locally available early childhood mental health services. So this is our challenge. Parents are aware, they recognize the importance, however, they're unable to access it. So to address this need, the Office of Early Childhood is looking at innovative practices to deliver early childhood mental health consultations and other support. This includes creating a warm line. That's an opportunity for families or providers that have a concern about their child to be able to call in and receive guidance or consultation or be connected to a consultant. Additionally, we're looking at the provision of early childhood mental health telehealth models that will allow for a deeper reach into rural communities and a higher touch with providers who may not have access to consultants in their community. The next will not be a surprise to many, really thinking about our ability to scale programming in rural communities. We know that rural service delivery is a perennial challenge, especially when we focus on subpopulations or those who are considered underserved or vulnerable. We just don't have the reach that we would like to be able to provide services to them. Some examples of this include family resource centers. So if you look at the locations of family resource centers across the state, you'll note that the counties and communities in purple are not served nearly as deeply as those in white. And so we really do have an opportunity to have a deeper reach in rural communities. As just noted, early childhood mental health service delivery is also difficult in rural communities. So as you look at your screen, we do have quite a deep cluster of early childhood mental health consultants in the metro region. However, again, once you get into rural communities, you're seeing more sparse representation. I think for me personally, it's really surprising to note that each dot represents about one FTE or employee. So when you're looking at some of these service delivery areas, it's not surprising that families are unable to access this service. So again, to help us meet the needs of families in rural communities, we're going to continue to look at how we can use models such as telehealth or telecoaching to support broader service delivery. We also want to continue to work with many of our local partners who are doing great work in rural communities, engaging and supporting families, and learn from them so that we can begin modeling that work in other communities. Additionally, what's not represented in our statewide strategic plan is targeting of those strategies to families or regions. And so as we continue to learn more about what's available, what's working, and where the needs are, we plan to target a number of our strategies to those communities that need to be served most. And that brings us to our last two needs, focusing on data. Through this process, and I think through a lot of our work, we continue to know that current data systems cannot provide unduplicated counts of children or parents participating in early childhood programs or receiving services. Additionally, these systems cannot assess any benefit derived from engagement in multiple services at the child or family level, or address long-term outcomes for children and families. Without the ability to understand this information, we are restricted in our ability to define investments and policies that would better serve children and families. So to address this, we have a few ideas. The first is to implement an IT or information technology roadmap that will allow the Office of Early Childhood Data Systems to begin to speak to each other. So creating some of those integrations and alignments that will allow us to think about how multiple programs are serving children and families and what that means for those children and families. We don't want to keep this good information to ourselves, and so we're also planning on developing a data warehouse and public-facing dashboard that will allow communities and local partners to also access early childhood data that will shape their decision-making and investments as well. That was a ton of information. So I thank you all for sticking with us through that. And I just, before we get into questions, want to share that there are plenty of opportunities for folks to stay involved. Again, during this process, we were able to engage over 10,000 individuals to inform the work of the Preschool Development Grant. I think it would be a significant disappointment, not only for myself, but for the office to not be able to maintain that level of engagement and to really have our pulse on how families, providers, professionals, advocates, and others are feeling about this work, what is changing for them, and where those needs still exist. So we definitely want you to stay involved and help us stay connected to those in your communities who will be impacted by this work. The main channel for our information sharing and alignment is through the Early Childhood Leadership Commission. They have a subcommittee called the Program Quality and Alignment Subcommittee. This group is where we meet every other month to share out not only our progress on the statewide strategic plan, but we'll also be speaking to the work by our partners who will be taking on additional strategies identified in that strategic plan. We also have a webpage, and so again, the link is available on your screen. And we have a monthly newsletter that we send out to partners that keep them posted on not only updates around the work that we're doing through the Preschool Development Grant, but opportunities that will come out of the grant. So as we think about some of the micro-grant applications, some of the other opportunities to really be able to benefit from this work, we want folks to be able to sign up for that newsletter to stay connected with us. So with that, we would like to open it up for questions. Again, we are asking folks to post their questions in either the chat or the questions box. Mary Alice and I are also joined by Lisa Schluter, who is the mental health lead under the Preschool Development Grant. So collectively, we are excited to hear from you and address any questions you may have. Okay. We did have one question submitted in advance of the webinar. So this question is, what are the plans for engaging early childhood councils to implement the Senate Bill 63 action plan? So similar to the PDG statewide strategic plan, this is a shared plan across the state. And so while there's opportunities for the state to claim strategies or recommendations from this plan, we're really looking for local partners who are also able to identify recommendations that may benefit or work well in your community and to provide leadership around those recommendations. And so the state doesn't have an intention right now to direct early childhood councils to take up those strategies explicitly. However, we would definitely support learning from you if there are strategies, again, in there that you are enacting in your community that are working well.
We have a handful of people sharing out that they have either telecoaching models or early childhood mental health consultants that are not currently represented in our data, or lessons learned that can be shared. So people want to know the best way to get that information to our office so that they can continue this exciting work, plug into it, and it can be in a good place to do.
Yes. So again, the Early Childhood Leadership Commission's Program Quality and Alignment Subcommittee is the forum where we would like to do a lot of the sharing. It allows us to engage with external partners and bring that information back to the office as part of our sharing, but it also opens up the door for partners to hear from each other. The goal of this is really not just for the office to be the only champion and to be the only actor around this work, but to really think about the partnerships that are meaningful. And again, the learnings that we can build on and perhaps inform future investments through. And then as for data, I definitely would encourage you to reach out to us directly if there is data that you would like us to be aware of or start incorporating in our work. We do have an email address. It's cdhs_pdg@state.co.us. It's also available on our website. But definitely reach out to us through that, and we'll make sure to be responsive to any requests or definitely take you up on sharing as well. Yes. So anybody that registered for an in-person or online event will receive a recording of this webinar as well as a copy of the slides that were shared tonight. And we expect that to go out no later than Monday. So we have a question regarding Pyramid Plus and how we see that. Sorry, I'm just reading the question. Okay, how do you see Pyramid Plus approach coaching aligning to needs for social emotional needs and behavioral supports in communities? Do you see this being paired with early childhood mental health? Coaching is key in supporting teachers. So we certainly do agree that coaching is key, and we want to make sure that we're leveraging proven resources, best practices, and tactics that provide a really rich experience for those receiving coaching. We do not currently specifically call out Pyramid Plus in our strategic plan. However, as we start digging into our coaching model and ways to make that more effective, that could be one consideration. Thank you. All right, we'll just leave it open for another minute or so if folks have additional questions.
Are there programs for students that are not ready for kindergarten but can't stay in preschool because they're 25 and their programs push them through?
That's a good question and one that I'm not able to answer right now. So we'll definitely capture this question, Jackie, and direct it to an individual that can follow up with you. Okay. So I have an individual who's on the board of a preschool who's curious about what upcoming changes will mean for us, if there's any clarity on that yet. So I would again recommend that you look into the strategic plan. There's a number of goals and activities that specifically target early childhood care and learning environments, focusing on changes to not only the quality framework, but really how we better support providers of preschool and child care. And so those strategies, especially those marked by Colorado State flag, are ones that we have committed to over the next 3 years and would flag kind of what the changes you may expect are coming down the pipe. So there is a question about plans to lower the under 2 limits to under 18 months. Also, experienced license holders being allowed to have a toddler or two with a 4 under 2 version. So again, that's a question I would love to pass along to Erin Mawhinney, our Division of Early Care and Learning Director. This is not something that we're addressing specifically through the Preschool Development Grant or Strategic Plan. However, I do believe there are some discussions around it, and she can provide more clarity on that question. All right. Well, I want to thank everybody for taking time to join us tonight. Your ongoing and continued support means a lot to us. We hope you continue to stay engaged over the next 3 years. The sprint of completing the needs assessment and strategic plan is over, and we now enter this marathon of really implementing some great opportunities and changes for Colorado. So thank you again, and always feel free to reach out to our team if you have additional questions or feedback as we continue this work.